sorry, she studied as an engineering student with an OND in industrial maintenance engineering. She's a graduate of University of Nigeria, Nsukka, with a Bachelor of Education in Technology, in Technical Teaching, Education and Electrical, that's in Electrical and Electronics option. She has an OND as a Certified Community Health Extension Worker from Lagos State College of Health. FAUSAT back and Masters of Education from the University of Lagos in Educational Technology. In pursuit of an entrepreneurial journey, she had her SME training at the Lagos Business School. She is one of the beneficiaries of the 10,000 Women Goldman Sachs Scholars. She also currently got certified as a social impact driver at EDC. She currently serves as the director. She currently serves as the Director Scholar Circle School, Director Kids and Teens Affairs, that's KTA Toys, co-founder Foundation Farms Limited. The journey of life and a survival journey created her NGO, Lorex Support Foundation, which focused on people living with lupus. She founded Lupus Remedies Global Support Foundation, Loreg, immediately after she survived. So you can see that she is a warrior. She is a warrior. So without much ado, I'd like to hand you over to Mrs. Sanusi for the presentation of the day. Mrs. Sanusi.
Yeah, good evening, everyone.
Good evening, good evening.
Thank you so much.
You have the floor.
All right, thank you so much for the introduction. Yeah, I'm glad to be here, and then it's actually been a very busy Wednesday, and thank God for being here today. And I believe at the end of the session, I will be learning one or two things from you all too. I don't know how you want us to do it. Should I just first talk about lupus?
Yeah, just
then probably we could. Okay, all right then. Yeah. I'm SANUSI FAUSAT OLUBUKOLA, and I'm a director Lupus Remedies Global Support Foundation. Our foundation focuses on people living with lupus, and then everyone would like to know what is lupus. Yes, lupus, Lupus as spelled. Systemic lupus erythematosus is a disease that many believe it is rare in Nigeria, but in our journey, we found out that it is not rare, it is quite common, but the awareness is very, very low. So lupus is an autoimmune condition. When you say autoimmune, that means that something that starts itself, that picks up by itself. So it's an autoimmune response that has to do with the body overreacting, body being in an overdrive, trying to respond to every little change that happens in the body. It's a condition whereby the body fights itself at a point where it's, let me put it a simple way. Let's say this is Nigeria and we have the military attacking the country. The police of Nigeria attacking the civilians. So that is just what happens when you see something is an autoimmune response, a condition whereby the body fights itself and thereby destroying all the organs one after the other. So lupus is how will I say it? It's something that's currently in the medical world, the cause is not yet known. This is the peculiar cause of lupus, but they could trace it to some factors that are called triggers that could trigger these lupus. And as a lupus patient, what actually is happening in the body is that the immune system is overactive. The immune system is overactive, over-responsive, such that when it sees any invader, it strikes immediately, and it cannot differentiate the good body needs from the invaders. So it keeps attacking everything. So factors that have been itemized that could cause lupus, they are basically one, the genetic factor. It has been found out that lupus is something that could be familiar. It could be in a family, and it could be something that's for many, not every member of the family can be carriers, but in every 10, 20 years counts, they could find one person in a generation to possess this gene uh, that carries the lupus. So another factor that has been identified is the environmental factors. Lupus warriors are a set of people that should not be exposed to some certain environmental um, things like sunlight. Sunlight is one of the basic triggers of lupus for a lupus warrior. So environmentally, when we are exposed to light, we are photo we are not we have photo reactive triggers
Yes.
lupus. Then another thing is the hormonal tamper. Lupus is a disease that reacts to hormonal changes in the body, and this has made it a disease of mainly women because the women are the ones that battles a lot of hormones in the body, the sex hormones, the reproductive hormones, the estrogens, and many other hormones in the body. So during the course of childbirth, we are exposed to taking a whole lot of medications. Many of us are even exposed to family planning, which we believe we are trying to control the birth control pills, um, hormonal family planning methods, injections, IUCDs, the implants, and then we think probably we are trying to, control childbearing, but unknown to someone that will be a carrier of lupus, person is actually waking up the sleeping giants because respond to hormonal touches. So this is where scientifically and through research, it has been found out that out of for every 10 people lupus carrier, we have 9 female and 1 male in the counts. So lupus is mainly the disease of women. Looking at the causes that has been identified through research, we can now talk about the symptoms. How do we know this is lupus? And lupus is a very, very tricky disease that's it's very difficult to diagnose, except if you have the opportunity to meet the main doctors for lupus, which are the rheumatologists. So the rheumatologists are doctors that deals with many of these arthritis issues, orphan diseases, and it's a special unit in medicine. So many doctors miss the gap because lupus represents like fevers. It just come like fever, like malaria fever, like typhoid fever. The sufferer keeps presenting headache, unexplained fatigue, unexplained body pain, and we can wake up in the morning and we might have gone to bed taking every necessary medication but still can't get up because the bones are weak, and most times we have pains, joint pains everywhere just submits to the pain. So it's just look like arthritis at times to some doctors, and they keep managing patients for that. But digging deep, other symptoms that could follow through will be the malar rash. That is the lupus. Not everybody will have a malar rash, but this malar rash or butterfly rash is one of the most common symptoms of lupus that makes it easily identified as lupus. It's actually present on the face and forms that shape of a butterfly that you will see that, oh, this is a butterfly shape. And then the sufferer has a lot of things going on, like it pains, it itches, and then in continuous pains. So when doctors see this as rheumatologists, they definitely identify and say, oh, this is a malar rash, then probably that person can go further to test for lupus. Another symptoms that is common in lupus is alopecia, loss of hair. Suddenly you see hair fall off without prior experiencing it before then. You just comb the hair and the whole, a lot of it can just drop off at a time. So those are the common symptoms of lupus. Then, and as it progresses, other symptoms that could come are the shortness of breath. The sufferer will cannot sometimes just cannot breathe well, and due to joint pains at times, some leads to stroke, leads to paralysis, and doctors sometimes believe probably in children, because lupus children have lupus now, so it's always it mimics like, oh, maybe it's polio, maybe it's just juvenile rheumatism, or many other diseases. People get lost in these diagnoses. So we always tell people, when a doctor, if you keep presenting malaria and then typhoid, and you see you are not getting any better, and it keeps reoccurring 2 weeks, 3 weeks, best thing is to seek the attention of a rheumatologist who can now present you for further investigation for the lupus or other rheumatic diseases. The alarming thing is that the investigation about lupus is not done here in Nigeria. We don't have a center yet to investigate lupus. So in most cases, we have our patients wait for 2, 3 weeks for their samples to be taken out of the country to Germany, Turkey, and South Africa. And but prior to that, there are some medical examinations that will have been put together to start treatment, but just waiting for confirmation to be sure this is lupus. So some pointers in the medical field are the ESR. Patients presenting with ESR most times are advised to be screened for lupus. Then lupus is a disease that moves from one organ to another. So types of lupus this will take me to. Most times we have the discoid lupus. Discoid lupus is the lupus of the skin. That's the one that's present mainly with the malar rash, and then it looks like skin ulcers. Many of the lupus warriors, some have been mistaken for um cancer patients or HIV patients because of the rashes not being identified as what it should be identified. So those ones, the rashes can come at any part of the body, but the prominent one that will tell you this is lupus is that comes to the face and present like a butterfly. So aside that, aside the discoid lupus, we have the juvenile lupus, and that's the lupus in children, neonatal lupus, lupus in babies too. Then we also have the lupus nephritis. This is when lupus affects the kidney, and this is very common today. And let me just say, many of the kidney issues we have these days, the foundation is lupus, but because the doctors mainly don't even are just getting to know of lupus, many have been wrongly diagnosed, and probably has led to kidney issues, which has led to them having dialysis over and over, or having to go for kidney transplants. So we always employ people today. If you have any kidney issue, always also request to be tested for lupus, so that you know you are dealing with a foundation cause. Then you will be able to overcome treating lupus, the nephritis aspect of it. So I think I've addressed the symptoms. Then how do we manage it? We are mainly based on immunosuppressant drugs, mainly steroids, And as we know, many of these medications also come with one side effect or the other. So they are regulated as time goes on. But then we also try as much as possible to do lifestyle modification in terms of feeding. We go mainly organic on our meals. Then we avoid sugary substances. We avoid some natural fruits too, like garlic. We can't just take garlic anyhow. Then we do more of gingers and some other vegetables, which are quite expensive, if I must say. So it's another world on its own. Then we take a lot of fruits and vegetables. So those are the ways to manage lupus. So talking about lupus, I also want to mention who can have lupus. Anyone can have lupus because one of the triggers of lupus is stress. So if we have an individual that has the silent gene as a lupus warrior and engage in activities that are quite stressful, it can trigger the lupus. Lupus can be silent for as long as the person is living well, it's probably not being exposed anyhow to sunlight. Then, but if you are living a stressful life and probably a lupus warrior, it makes it more prominent. It makes it easy to manifest. So stress is one of the triggers that can make lupus come alive. So as the time goes, as the studies goes on, I read when I first had my own lupus, I had to go on research, and we were through the research we got to know lupus used to be between the age of 15, which is the productive age, to about 45 years. So, but nowadays, as I said, we have the juvenile lupus, we have the neonatal lupus, we have in our clinic, in our community, as I speak, we have kids with lupus now, as young as 2 years, as young as 6 years old, suffering from lupus. So we begin to question where where did they actually come across it. So and the thing is, lupus can affect children, it can affect teenagers, it can affect young adults, it can affect adults, it can affect anyone. So it's a disease now of mainly all ages, and it's leaving no gender behind. But the alarming thing is that the society seems very silent about lupus, not because few don't know about it, but because it is not contagious. So you can't get lupus from a lupus sufferer. You can't get it by sneezing. You can't get it by touch. You can't get it by sexual intercourse. It's a gene in the body that is triggered by some factors I have mentioned. So leading to how does a lupus warrior now cope with all these said and done? We need all doctors. A lupus warrior suffers almost everything. The immune system has been suppressed. So the lupus warrior is exposed to almost all everything happening in the society. During the COVID, I could remember I was actually logged in because one, the immune system has been suppressed. So it's actually quite easy for people like her, the lupus warriors, to get infected with COVID virus. So it's just a life of being more careful, avoid exposures in as many ways as possible. Then I have said something on feeding right. Then we have the mental space, coping in the mental space. Lupus is a depressive journey. I have been in this space for about I had 10 years of wrong diagnosis actually, because my lupus story started in 2008. I started noticing these changes in my body. That
This
was
is
after
one that
my
they say
first after my first delivery. And then, it was not diagnosed quickly. I had 10 years of wrong diagnosis. And today, this is my fourth year of survival. And I have been coping well with it. Mentally, I had to have a mental health personnel that I worked with, and we look at the mental space. Lupus is depressive, so when you say depression is real, a lupus warrior is one of those people that's because you living a life where you have to move from one doctor to another. You need to see the nephrologist today, you need to see the dermatologist tomorrow, keep seeing the nutritionist, gynecologist, and it's a whole lot. Today you can be fine in the morning, and by night you've lost all the strength, and you can be okay by night, hoping to wake up in the morning, and you can't even lift any part of the body. So not be really as bad as that. So it's a journey that needs more awareness in the medical space. It needs more awareness in the feminine world. As a lupus warrior, there are a lot of things we can't do, and we need the society to understand. Like I need to mention the taking of as a lupus warrior is treatment of for COVID and any other diseases or any taking vaccines. You have to stop your medication so that there won't be interaction. So you can imagine many people that don't even know they have lupus and are just being given vaccination anyhow. So there is still a whole lot of research that needs to be done. There is a lot of things that needs to be told to the medical space that at times you give people vaccine, you see some reactions. How do we investigate if this person is a carrier? Not only lupus, there are many other autoimmune conditions. We have scleroderma, we have a whole lot of other autoimmune responses. So, but the space we are clamoring for here, it's the one that people don't even look. Many people don't even I believe in the room. Someone needs to be here hearing lupus for the first time. So we need awareness, we need advocacy. Then we need other space of treatment that could be brought up to support us and ensure that we all battle lupus together. I would like to stop here. I don't know if we will have some other things, questions that I could also share scenarios on how we manage through. Thank you, everyone.
Yeah, thank you so much, Mr. Sanusi. Thank you. You are really a warrior. You are really a warrior. I really salute you. You are a warrior. In fact, you have thrown a big light on lupus. I used to think it was contagious. You know, there was a place I went to. Somebody said somebody had lupus, that he went to an hotel, he used the towel, from there he contacted lupus. So I was like, is it contagious? But what you are saying, I think it's more of hereditary, right?
Doctors are not yet telling us it is hereditary, but the word familiar is what they always use for us. Like, okay, it is familiar, and it can run in a family, but it's not compulsory. Probably you have it, your child can have it. Though in the community these days, we have lupus mothers, we have mothers having lupus, and the kids also having it. But the research is still ongoing. Is this something that can be directly transmitted to your child? But the questions are still hanging. I believe with more research, they will be able to actually say it loud that lupus is it's hereditary, but the doctors still make it like it is familiar, meaning it runs in the family lineage. Yeah.
But the fact is that it is not contagious.
No, lupus is not contagious. If lupus was to be
Through sex,
contagious,
through touching and all
no,
that
no,
stuff.
no. If it were to be, the government would have actually addressed lupus. But
Maybe that
lupus is
was
not
why
contagious.
there is so much silence on it.
Exactly.
That's one of the reasons. Yes, I want to ask, what was your experience like when you first diagnosed of lupus? How did you take it?
Like I said, I actually had 10 years of wrong diagnosis, and the journey was so rough for me. because I was just like my CV could tell, I was just a young child, a female child, trying to build a career. And I suddenly noticed this weakness comes unannounced. But I wasn't really, I wasn't really seeing it as a big deal. I just felt it was a normal daily stress things. But when I had my first child, I noticed somebody change. And then it was then I started questioning what was happening. So seeing doctors and showing them I have this lump in my hand and it's coming up as a rash, they all tell me I've not seen this before. You meet doctors and they let you believe that I think it is diabolic. And in most cases in our community, you see people wake up and see maybe like some rashes in their body, and you hear in Yoruba, like, want a Tamil fight is arrow from the village. So these are some of the things that I saw when I started my reproductive journey. And then I saw these body changes, I saw some lumps. And I like my own journey. I actually had a family planning method I used that was hormonal. I never knew I was waking I was actually awakening the sleeping giant called lupus. So the first time I had lupus was like about 10 years after I have been battling in and out of hospitals. I have had malarias all over my body, and I don't really sleep anymore because there was nobody part to lay down. So for about some 2 years, I don't sleep. I will sleep. I only sleep on my stomach, and that's also leads to ulcer. So with these, it was like a lone space, and the belief of society is, oh, you have offended someone, you have stepped on something, you
Village
have
people.
you are, it became like a diabolic
Yes.
um a sin, and people will tell you, don't use medicine, don't take injection, let me take you to my pastor, let me take you to my imam. This is not a medical condition. You have to lotus but like Yorubas we say, you need to see the spiritualist, even if you can see an herbalist. So but then I have a teacher that will always tell me medicine before spiritual when it comes to things like this. So we kept on the medical investigation. So hearing lupus for the first time, I asked him, it was a dermatologist that saw my skin and said, oh, this is lupus. I said, what is lupus? So I had to go online. I read about it. Okay, fine, ma, this is lupus. Then what will you do? She now said, oh, I'll have to start some steroids. I was placed on steroids. I started using them. But being a dermatologist, she wasn't giving me the 100% treatment I should be having. So over the years, lupus came bad. It came worse. So, like I said, lupus is very, very tricky to diagnose. I the lupus moves from organs to organs. There was a time I had fluid in my lungs, and with this fluid in my lungs, I started having sputum with flesh. When I cough out real flesh, and we're afraid it was tuberculosis. So I was locked up at the IDH at Yaba, thinking it was tuberculosis. But I was personally convinced this is not tuberculosis because my tests were pointing negative. So I continued the journey, and actually then I had to Dama to tell them to just leave me, let me go. That I don't have tuberculosis. Yeah, I'm within people with HIV. I'm within people with tuberculosis. And
Yeah.
yet people are not too sure
I
of what
understand.
I have.
Mm.
So I had
It's
to
yeah.
leave. You
Yeah.
understand?
Mm.
So I
I
had to
understand. I
leave,
understand. Mm.
and
So let
getting to a
me
private, okay, getting to a private
yeah.
hospital, I was able to get a help. So I was placed on tuberculosis drug for about 3 years, not needing these medications. So this
Yeah.
led to some organ damage. And you want to say something,
Understood.
sir?
Yeah, thank you so much. Maybe I'll come back to you. Please don't leave us now. I want to just because it's an immune thing, something like that. So I would like to present our product to our first timers and our members so that they will know how they can boost their immune and also solve problems with products. So I'll come back to you, man. Just some minutes. Yeah. Yeah, please, my co-host, hope you can see my screen.
Yes, we can. Yes.
Yeah, because this month is lupus month, and we have heard from a lupus warrior, Mrs. Sanusi, and she has said a lot. She has said a lot, and I just want to tell us how we can boost our immune using our products. Using our products. Yes, welcome everybody. So I'll quickly do our product presentation of PHYTOSCIENCE. Yeah, okay, yeah. Got it. PHYTOSCIENCE. PHYTOSCIENCE is a company from Malaysia, and they have a partnership with Lupus Chemistry in Switzerland. We are in the business of wellness. You know, when we talk about wellness, about health, PHYTOSCIENCE is the place to be. We have a range of products, mainly stem cell products. And if you use our stem cell products, your immune system will be top notch. So I want to present to you some of our products. So on your screen, you have pistil cell and double stem cell. What are the benefits of double stem cell and pistil cell? They protect longevity of the skin. Stem cells, they fight chronological aging, they improve cellular health and energy boost, better blood circulation, they improve mental function and boost brain health, neutralizes free radicals, they boost your immune system, and so on and so forth. This product is they are very wonderful. These are flagship products. So with these products, you can never be wrong. If you have this product, just know that sickness will be very far away from you. How do we use double stem cell and pistil cell? They are used sublingually. What do I mean? It is poured under the tongue. You raise your tongue and empty a sachet on it, depending on the dosage you are told to do. So you empty a sachet under your tongue. It is not chewed or inhaled. Empty a sachet under your tongue. It is expected to go through a sublingual duct, and it goes straight to the bloodstream, connects with the brain. The brain tells you where there are problems, and it goes there and begin to do justice. We also have a very powerful product called Stonefield Fort. Stonefield Fort is a very powerful product. It's best aid in gastrointestinal problems. It balances the body acid alkaline count. It rebuilds hemoglobin and red blood cells. Excellent for sickle cell anemia, fights all forms of infection, and manages blood cells. And manages blood sugar. It's a very, very, very good product. Every single person who has cancer has a pH that is too acidic. So you don't want your body to be acidic. So you have to use a Stonefield Fort so that cancer will not thrive in your body. Now, who should drink Stonefield Fort? People with diabetes, colon cancer, kidney disease, hormonal imbalance, liver problem, rheumatism, pale complexion, weight problems, heart attack, high blood pressure, and so on and so forth. How do you consume double stem cell? Stonefield Fort. You empty a sachet in a glass of water, just empty it, then stir very well and consume. The molecular shape of these products is very similar. If you put it down and check the molecular the shape, is very similar to that of blood. So it is called the green blood. Is why it's very good for people that have sickle cell. It's a very good product for almost all kind of diseases and ailments. Now you have a very powerful product product which is Actual Plus. It has 18 fruits, 12 vegetables, and 9 spices. The best option that helps you to heal and recover from all diseases, especially diabetes. The best to boost, strengthen, and build your immune system. In fact, the scientists that invented this drug said that it's not a drug, but it works more than a drug. It's not a drug, but it's works more than a drug. Now, if somebody is sick and he wants to recover quickly, we advise that he takes 10 drops in a glass of water, 10 drops 3 times daily, morning, afternoon, and evening. For maintenance, just for body maintenance, to ward off all form of sicknesses, just do 5 drops in a little glass of water 3 times daily. Shake before you use. Do not use in hot water. Do not use in hot water. It's a very powerful product. And also we have Miracle Intense Essence. Even in the name is powerful. It is miraculous. It is intense in its work, and the essence is awesome. So it reduces spots and wrinkles. It betters skin texture and skin tone. It enhances skin vitality, moist and supple skin. It speeds up wound healing. In fact, I tell you, if you have any wound, be it diabetes gangrene or a sore that I refuse to heal, please use our product. To be amazed at how fast the wound will go. It's a very powerful product. We also have H2O moisturizer. This is very good. It's very good. If you want your skin to look supple and very firm, please, H2O is a go-to moisturizer. We also have IQ Plus. This is also a very powerful product. It improves the brain health, cognitive function, memory, and even mood. It reduces the skin of molecular degeneration, protects brain cells from damage by toxic free radicals, prevents memory loss and mental decline. It reduces mental fatigue, improves eye function, including the eye ability to adapt to dark, enhances cognitive ability in older women. So because of our time and we have a guest, that is the product I'd like to take on for today. We have Head Direct on Mondays and Wednesdays. If you want to have the full presentation and our products, please come on Wednesday and on Monday next week. So you have the full presentation. Today is a special day. It's a lupus month. So we are focusing today on lupus. But I just have to talk about our product. Our product is certified. The product is certified by NAFDAC, is halal certified, is GMP certified, and the proper of them all, the FDA certificate is also here. We have it from the US. So for you to know that we are not joking, we are in the business of healing people and also improving people's lifestyle. So it's a very wonderful one. Our product is insured. Can you beat that? We have an insured product. The best you can see in most products is they'll tell you money back guarantee, but in ours, it is insured. In fact, when a product is insured, it shows that the manufacturers knows what they are saying about the product. It is insured to the tune of $1 million by a company in Japan, which is Mitsui Sumitomo Insurance Group. They say that if you use that product and anything happens to you, and it is found out that that is the cause of the problem, you can sue them to the tune of $1 million. We have testimonies in PHYTOSCIENCE, very beautiful testimonies, testimonies that make you wow. The testimonies you see in worship places, they're very very breathtaking. Before I go to the next slide, it's a very if you don't have heart for the how do I put it? For image that you cannot bear, please you can look away as I put on the next slide. This is a diabetic gangrene. This is a testimony from Uganda. We can see effect of PHYTOSCIENCE combinational therapy that using crystal cell, double stem cell, and miracle intense essence, on also actual plus and stone for. So for this is a 6 years diabetic woman. If not for our products, I tell you, this leg would have been amputated. But thank God for our products. This person saw one of our distributors in time, and we are able to save that leg. So thank you. You can see the first day, the first month, and the second month, and also the fourth month. And today I tell you that this person is now very well and healthy. And we have a bone marrow cancer. If you see this woman, the last I saw her video in Dubai, he was just all over the places. You know, when doctors have told you to go and die, and at the nick of time, a succor comes to you, reviving all the cells in your body, and it's taking away what have been a depression, what have been a death threat to you. You know how happy that can be. So this woman has been, is now a PHYTOSCIENCE ambassador. He's going all over the places, preaching the gospel of PHYTOSCIENCE. He's now very well. It's very well. This is a testimony of his LIGO from India. Time is fast spent, so I'm just running through this. I think this 3 years without working. She recovered within a month after taking crystal cell. So it's a very wonderful one. Very wonderful. We also have a testimony on infertility. Somebody that have been barren for a long time. After trying IVF and all what is not, he came across one of our distributors, was introduced to our products, and within a short time, he got pregnant and now had a twins, 2 bouncing baby girls. Now, you may be asking yourself, how can you join the train, the PHYTOSCIENCE moving train? You can join, you can become a member by getting one of our packages. We have the platinum one. It is $2,731.58. You will be given 32 packs of crystal cell, 4 bottles of actual plus, 2 packs of IIQ, 3 bottles of MIE, 30 packs of double stem cell, 1 bottle of H2O, and 10 packs of stone fort. We have the platinum 2, which is $2,449.93. You'll be giving 2 packs or 2 bottles of actual plus, 20 packs of crystal cell, 30 packs of double stem cell, and 6 packs of stone fort. You have the junior platinum. It is $1,470.06. You can see what you'll be given on the screen. We have the gold package, which is a $94.55, which will be giving 22 packs of double stem cell, 4 packs of stone fort, and 4 packs of crystal cell. And let me tell you, there's a promo on this. If you get a gold package, you will be promoted instantly to the platinum status. Your status will change instantly to become a platinum. And I tell you, if you want to maximize your earning in PHYTOSCIENCE, this is the place you want to be there at the platinum status. We also have a silver package, which is $206.40. And you'll be giving 1 pack of crystal cell, 4 packs of double stem cell, and 1 pack of snow field fort. that is what will be given. And we also have other packages, but I have said the best of the packages to you. So for further information, you can contact the person that introduced you here. So thank you so much, Mrs. Sanusi. Hello, Miss Sanusi.
Hello, I'm still with you, sir.
Yeah, sorry. I just have to tell people about our product, which is
No
working
problem,
wonderfully
sir.
well. Even
No
people with
problem.
lupus can use it, and I believe it
Mm.
will do good, very good for people with lupus. Then I want to ask you this question. Then what do you wish people knew about lupus that they don't know?
Well, there's a lot we wish people know about lupus. The thing is that awareness on lupus is low, and then a whole lot of things are happening right from the primary school kids. So the first thing we want people to do about lupus is that please let's join the awareness. Let's tell someone about lupus, and maybe we will be helping someone even within our own immediate environment. The second thing is that please, unconditional love is needed. If by chance we have someone with lupus within our family or community, or by chance a colleague at the office that cannot cope again with normal daily stress, we should express unconditional love. To employers of laborers, we should try as much as possible to give a level of understanding for staff living with lupus. It's an expensive word for us because our medications are very expensive. We have one of our medications, the rituximab, is 585,000 naira as we speak, and that is just a dose. So we should show
Just a
love,
dose.
just a dose. We should show love to people with this condition through support, whichever way we can. We should. Then, and another great thing we want the community and people to do is that we should stop the stigmatizations. I used to be a size 11, size 12, but because of steroids, you have to change in look, you grow bigger, you become so fat, and people will tell you, see how fat you are. So at times, you don't know what that person is going through. For lupus, we don't even look, we're going through a lot. Because when you start taking these medications, you look like you are living well, you are living okay. But even if you give a touch, you will see that this skin is so light, so soft, and it's not just a normal skin. So we should join the voice against stigmatizations of people living with um, all these conditions, and also join the voice. Then we should know lupus is not diabolic. All these what
It's
Tamilofa,
not
that
it's not village people.
it's not village people. It's not village people. And
Man.
again, lupus is not contagious. You can't
Okay.
get it from anyone. Thank you, sir.
I want to ask you what inspired you to start sharing your story, creating awareness about lupus? Because it's been
Actually,
you so
yeah.
what inspired you to start sharing your story?
Yes, what inspired me was actually that in 2021, I actually totally gave up. I believe I'll die. And then I felt it was over. So that year, I actually gave out everything, did a will, and hoping that God will come soon for me. So I then looked at it that what actually is happening. Is it that I'm the only one in the world suffering from this type of condition? And I was beginning to have it in my head that is it true that I've abused one baba or one mama? Did I talk to anyone? And it's becoming like a war in my head, trying to blame myself or somebody I've offended, I don't know. So I just decided one day, my husband too was not understanding it because when you see the malariachis, they look quite small. And the pain you are expressing, it's like, is the whole world over you? And my husband was at that point of these small, small things that you are expressing this I was like, heck, you can't even understand. So at that point, I went into a studio, I did a video, and I had to send this around the world to ask people, have you seen this type of condition before? So my speaking out got people into my DM. I have a friend that has it. I was diagnosed of it. Many people from the UK, and they sent me medications and they gave the support, calls, love, and even without medications, I was already getting back to life. Oh, you are not alone. So I believe that telling my story to other people will also assist lupus warriors to live again. So as I
It's
talk to you, the
it's been
community is
very
about
inspirational.
1,000, yes, 1,600 lupus warriors across different states. So you can see someone helped me by support. So I decided to also extend this support to people. So we are not alone.
I want
And
to say a big thank you for that. But you are
you're
a real
welcome.
warrior. You've been very, very inspiring. Let me ask you this last question. What message do you hope to convey to people about living with lupus?
All right, I didn't get that.
So what message do you hope to convey to people about living with lupus?
For people living with lupus, our message of hope to them is the key message. The first one is that there is God. You have a faith. You connect to Him first. Then, connecting to Him first is one thing. Acceptance of who you are. Then you need to turn your pain to purpose. For everything in life, for every pain should be a ladder. Don't let lupus limit you. Don't let lupus limit who you are. It might delay a lot. I did my MSc for 10 years because of this condition. So delay is not denial. Just keep showing up. Don't sleep in your pains. Don't sleep in your pains. Keep showing up. Participate in few things you can do. We can do graded exercises. You have to do the graded exercises. Modification, if the minimum you can afford, it's quite expensive, you know. So we always tell them just do something, keep showing up, be positive, delete all negativity, leave what you cannot control. So with this, you keep creating programs. I task myself for events every time to live well. Once I have a project, I get distracted. As I'm talking to you, I'm in pains. But you know, when I have something to do, I just focus on that thing.
Yeah.
Then the pain will be there, whether I like it or not. Lupus is always a painful journey. So we
Thank
just
you.
hope
Yeah.
that cure will come one day.
Thank you so much. We are stressed enough. Thank you so much. We want to sincerely appreciate
Thank
this
you.
moment. We are not taking it for granted. We thank you and we pray that God bless you and wish, I mean, do for you what you wish for yourself. So thank you so much, Mrs. FAUSAT OLUBUKOLA. Thank you so much. We are very,
Yes,
very
sir.
grateful. So, Madam Slexia has something for us. I think I will hand you over to Slexia. I think there's a question from Ms. Prof. Can you unmute yourself? Prof?
Okay, thank you so much, ATM.
Yes.
A wonderful presentation, ma. I learned so much from this presentation tonight, ma. Thank you so much. I have something to say about lupus, ma. I think that alongside other autoimmune diseases, T cells and B, immune T cells and immune B cells contribute to the immune cells attacking healthy cells, thinking they are enemy cells. With our products, the bad cells, the bad T cells and B cells that cannot recognize healthy cells are pushed out and replaced by good T and B cells. And if it is the case where the cells that have been attacked are already, maybe they are defective, they are not what they should be, our products also replace those cells, regenerating the entire body. I have handled a case of autoimmune eye disease. In fact, the girl was told that the thyroid had to be removed completely. And in just a week or two, her story changed. I also handled a case of a woman who had a lupus-like ailment and then even had a pacemaker attached to her heart. And the products took care of all that. So I have a feeling that our products will help in taking care of lupus. Thank you once again, ma.
Thank you. That's Professor Adeloye.
Okay,
Professor,
very good.
from University of Lagos. So, Slegia, please, over to you.
Well, I don't know how I'm going to say, because Madam FAUSAT, this is me saying thank you so very much. We met, I met Madam FAUSAT at one of the awareness she put together at the LASU in Ikeja, Lagos, Nigeria. And I was privileged, I have the privilege honor to be one of the attendees of that event that day. And sincerely, you can see she's wearing a badge, and I'm wearing that badge today also.
Oh, you still have the badge.
So we have a solidarity movement. I have my
Okay.
Lupus badge here. So Mrs. FAUSAT, I want to say a very big thank you to you first for honoring our invitation. It is not easy for us to want to invite you, for you to share your personal story, and you took time to explain everything in detail. I'm sure everyone who is seated here this evening is going back home better informed about what lupus is. And I'm sure, if I can vouch, maybe 50% of the people who attended tonight's presentation do not even know what lupus is at all in the first place, and they are hearing it. They may have a neighbor, somebody somewhere who is going through a lot of things, and just like you stated, they might have been thinking it is village people, it is a diabolical thing, or maybe the child is all these children that they give birth to and they have to turn to where they are coming from. But from everything you have stated today, we want to say thank you so very much. And we believe that it is God that created human, and in his own time, he will make all things good. And just to support the words of Professor Adeloye, I want to tell you, ma, PHYTOSCIENCE stem cell goes in and works with every single organ in the body. By the time this is getting to combat this, PHYTOSCIENCE is there to fix whatever the case may be. The Atropos is awesome. The Snowfield 40 is wonderful. The crystal cell and double stem cell are something. For every dermatological thing, just put our H2O and Miracle Intense to the test, and you will see there will be no butterfly, there will be no rash, there will be no ulcerated body. I want to say a very big thank you to you. And we don't, there is no time again for question and answers, permit us. But we have something that we want to announce to the house today. And it is coming directly from the management of PHYTOSCIENCE. Please, I want everybody to help me go to the reaction button and give a reaction to the management of PHYTOSCIENCE. We are making this pronouncement. If there is anybody here who has lupus, if there is anybody here who has lupus and will want to test PHYTOSCIENCE stem cell therapy, the management is volunteering a 5-week therapy for one person. So if there is anybody who has lupus right here, can you quickly indicate? I'm going to be picking the fastest person. If you are in this house tonight and you suffer lupus, the management of PHYTOSCIENCE is going to be giving you a 5-week therapy for free. This is so that, just like Madam FAUSAT said, that they are looking for how people can really help with creating the awareness to avoid stigmatization, to help people live better. You see what she said? She said just one dosage of a medication is over 500,000 naira. Over 500,000 naira. So tonight we are offering one person that suffers lupus. Please indicate. My name is Alex Idori. If you are here and the person who's invited you, please get back to the person. Let them reach me. My name is Alex Idori. Let them reach me and we will get for you 5 crystal cell, 1 Snowfield 40, and we are going to add 1 Atropos to it. But we'll follow with you, we'll follow through with you on that journey to see the reaction. And definitely, I hope you're not going to keep it to yourself when Phytoscience has done so beautiful that it's going to do for you. So if there's anybody who is here, my name is Alex Igori, and somebody has invited you to this presentation tonight, quickly, I will be picking the very first person who indicates. And
hello, ma'am. Somebody indicated already.
Bukola Smith.
Yeah, Bukola something. It's in the chat room.
Bukola Smith. Please, Bukola Smith, can you unmute yourself?
Yes, please. I've unmuted.
Thank you. Good evening, Mrs. I hope I'm permitted to say Miss or Mrs. Bukola Smith.
Mrs.
Bukola Smith. Who invited you to this presentation tonight?
Okay, it's a lady I met at a fair, and she invited me.
Do you know the name of the person?
I can't remember her name, but she
trace the message and give the person a call?
I will do that tonight.
Okay, Mrs. Bukola
I really want to try this journey for a long time.
Okay,
I really would love
Bukola
to.
Smith, I don't know. I'm going to send you a private message, and the message is going to be with my phone number. Bukola Smith, since we can't find who has invited you right away, I'm sending you a private message with my phone number. Please get in touch directly with me, and we will trace the person who has invited you together. I've sent you my phone number, and we are going to start you on a 5-week therapy. Please, I want everybody to go to the reaction button and give a reaction to Phytoscience. This is not something that is very, very small. Thank you so very much. Mrs. Bukola Smith, I'm expecting your message to drop right now. I just sent you my number. Thank you, everyone. I'll give you back to all the money.
She's saying something. Thank you so much, Slexia. That's Alex Igori. Thank you so much for that. And the management, thank you very much. Mrs. Sanusi, thanks. Please, let's go to the reaction button. Let's have some reaction for Mrs. Sanusi, please. It's not easy. Please, reactions, please. Reaction. Thank you so much. Thank you so much. Thank you so much. We are not taking this for granted. Thank you. And yes, the winner should get back to Alex Igbo. I think she has sent your number to you sent your number to her. So thank you. Our presentation, it is a call to unmute everybody, which I'm going to do now. I'm going to unmute everybody, and I will say, who are we?
Down the left-hand channel.
Who are we then? We echo, we are. So unmute yourselves. Who are we?
We are the
trendmaker. Thank you so much. We have our health direct every Monday and Wednesdays. Please join us next Wednesday by 8 p.m. Thank you so much. So see you next week by 8 p.m. Bye-bye.